Medicare Open Enrollment, what you need to know if you will soon qualify for Medicare. We at NORD, the National Organization for Rare Disorders, have important information to share about Medicare insurance coverage for anyone who has just turned 65 or will be Medicare eligible soon. Open enrollment. First, let's talk about some important dates. The Medicare Open Enrollment period is from October 15th to December 7th each year. This is the time when you can make changes to your Medicare coverage. However, if you're just turning 65, you have a special initial enrollment period. This period starts 3 months before your 65th birthday, includes your birthday month, and ends 3 months after you turn 65. Make sure to enroll during this time to avoid late penalties. Parts of Medicare. Let's talk about Medicare insurance plans. Medicare has 4 main parts. Part A, which covers hospital stays. Part B, which covers doctor visits and services and drugs provided in the doctor's office. Part C, also known as Medicare Advantage, which bundles Part A and Part B and often includes prescription drug coverage. And Part D, which helps cover the cost of prescription drugs. You might also hear about something called Medigap, or supplemental insurance. People who have traditional Medicare, which is Parts A and B, often pay for a supplemental Medigap plan to help pay for copays and coinsurance for doctor visits. The best time to buy Medigap is during the Medigap Open Enrollment period. The Medigap Open Enrollment period runs from the first day of the month you turn 65 through the next 6 months. You must be enrolled in traditional Medicare to purchase Medigap coverage. If you enroll in a Medigap plan during this time, the insurance provider cannot charge you more because of your health or medical history, or deny you coverage due to a pre-existing condition or diagnosis. If you enroll after this 6-month period, your insurance provider can charge you more for your medical history, refuse to sell you a plan, or deny coverage for some services. Choosing your plan. Choosing between traditional Medicare and Medicare Advantage can be confusing, but here's a simple breakdown. Traditional Medicare, or Parts A and B, gives you the flexibility to see any doctor or hospital that accepts Medicare. A Medicare Part D prescription drug plan can help cover the costs of getting medicines at the pharmacy. Medicare Advantage bundles Parts A, B, and usually Part D into one plan. These plans have networks of doctors within their plans, so make sure your favorite doctors and prescription drugs will be covered by the Medicare Advantage plan you choose. Medigap can help with out-of-pocket costs, like your deductible or copays, but is only available if you choose traditional Medicare and is not available for those who choose Medicare Advantage. Prescription drug coverage. It is very important to make sure all your medications are on the list of drugs covered by your Medicare prescription drug plan. The list of drugs that are covered is called the formulary. Drugs not covered by the plan are called not on formulary. Starting in 2025, there will be a $2,000 out-of-pocket limit for prescription drugs if you have a Medicare Part D plan. However, if you pay for a medication that is not covered by your prescription drug plan or not on formulary, that payment will not count toward the $2,000 annual out-of-pocket limit. To help spread out of pocket prescription drug costs, out over the year, starting in 2025, you can choose to join the Medicare Prescription Payment Plan. This is an option as part of your Medicare Part D plan that makes it easier to afford your medications with smaller monthly payments spread out over the entire year until you reach the $2,000 out-of-pocket maximum owed, instead of potentially having very high copays or coinsurance amounts owed at the beginning of the year. So in closing, a few final do's and don'ts. Do carefully think about the pros and cons of traditional Medicare and Medicare Advantage. Switching between traditional Medicare and Medicare Advantage in the years ahead comes with its own issues. If you choose traditional Medicare rather than Medicare Advantage, do make sure to buy both Part B and Part D plans, or you could face higher monthly premiums for life. Don't choose your plan based on your premium. Some plans might have $0 monthly premiums, but you could end up spending more on other costs. Do make sure your doctors are in network for the plan you choose. Do ensure the drugs you take are covered by the plan you want, and review your Part D prescription drug plan every year since formularies change. If you have high prescription drug costs, do look into the Medicare Prescription Payment Plan to spread out copay and coinsurance costs over the year. Don't wait to buy a Medigap plan if you choose traditional Medicare. Medicare coverage can be complicated, but there are resources available to help. Check out the Medicare Plan Finder at medicare.gov or reach out to your state health insurance assistance program at shiphelp.org, that's shiphelp.org, to help you get the information you need to make the Medicare choices to best meet your medical needs.